Breast cancer is one of the most common cancer in women, but the good news is that early detection saves lives. Welcome to the world of radiology. In this video, I'm going to give you some preventive measures and treatment for breast cancer and some advices and recommendations that may help. I'm going to be joining the prevention with some of the factors that are associated with an increase in the risk of developing the disease. So if I mention a factor, the treatment will follow. If I mention a factor, the treatment is going to follow. In that order, that's how we're going to go. Because knowing the cause solves half of the problem by giving you the idea on how to go about the prevention and the treatment. So in this video, you need to be very attentive. If possible, you jot something down, because this is one of the most sensitive parts of this video I'm making right now. Don't be distracted, and I assure you, at the end of this video, you're gonna learn something that will help you or someone close to you. And of course, if you have any question, you can drop it at the comment section below, and I'll be very excited to answer you, because that's one of the main reasons of having this platform. While not all breast cancers can be treated, mainly your lifestyle choices can lower extremely or reduces the risk of getting the disease, because many people want to know what they can do to lower the risk of developing the disease. Although there are no conclusive evidence behind some of the factors associated with an increase in the risk of the disease. But know that these factors are higher than average risks of developing the cancer. Some of the factors associated with an increase in the risk of developing breast cancer are: firstly, your gender, that is you being a woman; secondly, your age; and then thirdly, which is the most important one, is genetical factor. There is a gene called breast cancer gene. It is also known as tumor suppressor gene. It is divided into breast cancer gene 1 and breast cancer gene 2. And the role of this particular gene in the body is to repairs damaged DNA cells and also prevent uncontrolled cell growth. But of course, if this gene is damaged or is mutated, definitely it cannot have the ability to repair the DNA cell again, and this will lead to the accumulation of so many genetical errors, which will increase the risk of developing cancer, most especially in breast cells. I want you to know that there is no control over such condition, because it can be inherited. It can be inherited. So the prevention for that is that you should be able to engage in self-breast examination regularly and report any symptoms you observe very early to the doctor for investigation and other possible solution, because early detection saves life, of which I've mentioned earlier. Early detection saves life. So that is one of the main preventive measures that can save an inherited breast cancer, or someone that is in the lineage of a history of breast cancer. One of the preventive measures is that you should attend routine mammography screening. It could be annually, which is recommended by WHO. Other factors like lack of exercise, smoking, drinking, and eating some certain foods are also associated with an increase in the risk of developing the cancer. But know that all this can be altered. This can be altered. This can be changed, unlike the genetical factors that cannot be changed. That one is inherited. How? They can be changed by making a healthy lifestyle choices. I take it again. They can be changed by making a healthy lifestyle choices, which can extremely reduce or lower the risk of developing the disease. So you need to take your lifestyle choices very important. These are some of the recommended healthy lifestyle choices that can help to reduce the risk of breast cancer. You need to maintain a healthy weight. Exercise regularly, at least 30 minutes, 5 days a week. Secondly, you need to avoid smoking because it's linked to several cancers, in which breast cancer is included. You need to reduce drinking of alcohol or avoid it if you can, because it also increases breast cancer risks. Eat balanced diet food that are rich in fruits, protein, and vegetable. And also, you need to limit processed food. You need to limit processed food. And then lastly, breastfeeding also lower the risks. That's for women that have babies. So moving quickly to the treatment of breast cancer. This treatment depends on the stages and the types of the cancer. The treatment comes after a confirmed diagnosis or after a diagnosis is being done and you are confirmed with the disease. Talking of the stage and type of breast cancer, I want you to know that there are different stages of breast cancer and also different types of breast cancer. So the treatment varies depending on that. So just to shorten this video, I'm just going to mention the treatment without diving deeper into the explanation of the treatment. But I'm going to make a detailed video on the treatment, the timeline of the treatment, the booking, the sequences, and biopsy, that's if required, for one to know which one to go for at the moment. So this treatment includes, number one, we have surgery. The surgery is divided into two, of which I'll make a detailed video on that for one to know which one to go for at the moment. So the surgery is divided into two. Number one, we have lumpectomy. Number two, that's under surgery. We have mastectomy. So second on the list of the treatment, we have chemotherapy. Third, we have radiotherapy. Fourth, we have targeted therapy. Second to the last, we have immunotherapy, which is coming from the word hormones, hormone system. Then last but not the least, we have immunotherapy. It's coming from the word immune system, immunotherapy. So these are the list of the treatment for breast cancer. And each of these treatments has their own sequences, their own timeline, their own appointment, and their own booking. And meanwhile, don't forget, if you have any question, drop it in the comment section below. So these are some advices and recommendations that may help. Number one, you need to stay consistent with any medical appointment. Report any signs and symptoms early. Eat healthy, as I've mentioned earlier, because it helps in the treatment and also boost the recovery. Stay hydrated. It means drinking a lot of water because it helps in reducing fatigue and also help the body in processing medications properly. Prayers, meditation, and counseling, it helps. Avoid unverified herbal drugs or medicine that are not recommended by your doctor, in which you need to always ask your doctor before taking any supplements. And here is a summary of all I've just said in this video. In the prevention has to do with the lifestyle choices and then screening, routine mammography screening. Under the treatment, we have surgery, we have chemotherapy, we have radiotherapy, we have targeted therapy, we have immunotherapy, and hormone therapy. Under advices, you need to stay consistent, eat healthy, stay hydrated, exercise regularly, and avoid some certain foods, of which I've mentioned them earlier. Lastly, under the recommendation, you need to know your risks. Is it from the ones that can be changed or from the ones that can be inherited? You need to know your risks. You need to know your risks. Secondly, these recommendations are very important. Secondly, you need to start the screening early, which is the routine mammography screening. It could be annually, which is recommended by WHO. I've mentioned it earlier. And seek medical help promptly. That's the last one. You need to always seek for medical help promptly. So if this video is really impactful to you, don't forget to subscribe, like, and share, so we could create a community of interaction for deep learning and understanding of healthcare practice and medical imaging practice. Thank you. Stay informed, stay aware, and remember, early detection saves life. Exploring medical imaging across the world with Ilya Joel Isaac. Peace.